In this video, we'll talk about when is the right time to start insulin. Let's first look at the pros and cons of insulin compared with other medications for diabetes. First of all, insulin can definitely bring your blood sugar down as long as the dose is high enough. This is not true for other medications. Most of them can only reduce A1C by no more than 2 points. However, people can gain weight from insulin. Besides, people can get low blood sugar from insulin, especially from short-acting insulin. So I would try to stay away from short-acting insulin if you have type 2 diabetes, unless no other medication work. And insulin is an injection, so you will have to do it every day or even multiple times a day, unless you use insulin pump. These are the situations that you should consider using insulin. First of all, if you have type 1 diabetes or if you're pregnant, you should use insulin. Also, you should use insulin if A1C is not at a goal despite multiple medications and despite your best effort in changing diet. If you're just found to have diabetes, but A1C is very high, especially over 9, you should use insulin. Most non-insulin medication only reduce A1C by 1 point, and by adding more medication, the return of investments for each medication will diminish. As a result, it will be difficult to lower A1C to less than 7 without insulin if your A1C is already higher than 9 at the beginning. Also, steroid can raise blood sugar dramatically. If you have to start taking steroids and blood sugar rise, you should take insulin on those days that you have to take steroids. Now I will show you a few examples. The first example is a gentleman who was recently found to have type 2 diabetes. His A1C was 7.4, so his A1C is not very high. 1 or 2 medications should be able to get it down and we won't have to bother with insulin. He started to take metformin and reduce carb in his diet. 3 months later, his A1C dropped to 6.6. The second example is a lady who was recently hospitalized for high blood sugar. Her A1C was 12. This is the first time she knows about diabetes, and she has not started any medication yet. Since her A1C is so high, it will be very difficult to bring her blood sugar down to a safe level without using insulin. So we started insulin lantus, which is a long-acting insulin. By using long-acting insulin, she will be able to keep blood sugar down throughout the days. The dose of long-acting insulin is based on weight. You want to start with a low dose so the blood sugar does not become too low, and you can always raise the dose later based on blood sugar numbers. She's on the heavy side, so we started 30 units every morning. Most people should start from 20 to 40 units once a day depending on their weight. For long-acting insulin, it does not matter whether you take it in the morning or at night, as long as you take it at the same time every day. Next example is a gentleman who was recently found to have type 2 diabetes. His A1C is 9.5. He was overweight. He is strongly against using any injection. He was determined to change diet. We started metformin. He has radically changed his diet, lost 30 pounds. When he came back 3 months later, A1C was 7.2. So it seems that we can get blood sugar controlled with the second pill. We started Januvia in addition to metformin, and his A1C came down to 6.7. Remember that we mentioned for people with A1C higher than 9, they should start to use insulin. In this example, I just want to show you that's not a hard and fast rule. For very motivated people, they can bring down blood sugar a lot by changing diets. In this case, his efforts saved him from daily injection. The next example is a gentleman who was recently discharged from the hospital. He was hospitalized because of COPD flare-up. After discharge, he was instructed to take prednisone, which is a type of steroid. He would start with 40 mg of prednisone once a day and reduce the dose by 10 mg every 3 days. His blood sugar used to be well controlled with metformin and Jardiance, but since prednisone was started, it jumps above 200 all day and sometimes over 300. Since steroid can raise blood sugar dramatically, we need to give him insulin to control that. Generally speaking, non-insulin medication are not strong enough to take care of blood sugar jump from steroid use. So I asked him to check blood sugar every 6 hours and start to use Humalog according to a sliding scale. If you don't know what is sliding scale, please refer to the other video on this. It basically is a scale that tells you how much insulin to take for each specific range of blood sugar numbers. Next example is a lady who had diabetes for many years. She was taking multiple medications including metformin, Trulicity, and Jardiance, but A1C is still 8.7. Her blood sugar at home has been running between 180 to 300 most of the time. So we decided to start insulin lantus 20 units a day. Insulin lantus is long-acting insulin. Her A1C went down to 7.8 in 3 months. She checks blood sugar twice a day, before breakfast and later in the day after lunch or dinner. Her blood sugar before breakfast was in the low 100s, but later in the day it climbed up to around 200. Why do you think her blood sugar climbed up later in the day? It's not surprising, isn't it? Blood sugar will climb up after meals, so she needs short-acting insulin to prevent blood sugar from spiking up after meals. We started Novolog 7 units before each meal, and her blood sugar later in the day came down to about 150 on most days.